Et je tiens aujourd'hui publiquement à les remercier au nom de l'ensemble de mes collègues pour leurs conseils, pour leur engagement et leur service à la nation. Et j'en profite parce que nous sommes ici au Palais des Congrès de Montréal, dans l'un des plus grands centres de vaccination dans la province du Québec.
One of the largest vaccination centers in Quebec. I want to thank all healthcare professionals, those who made a difference to save lives, and we want to meet them. And on behalf of all my colleagues, I want to thank you for their hard work. With the spirit that I shared with you, we have established partnership with Canadian companies and institutions, as the one you know in Saskatchewan, and one in Vancouver that I had the chance to visit last week, and this one here in Quebec, who are developing vaccines as well, and the research in Montreal. We've all seen internationally renowned companies here in Canada, and this morning I have the pleasure to say that Moderna has been added to this list. Today, ladies and gentlemen, a vaccine leader has joined itself to Canada, and so we are happy to announce that we have concluded a few days ago an agreement protocol with Moderna to build here in Canada a cutting-edge technology plant to develop mRNA vaccines that will assist us during this pandemic, and I would say even to help Canadians be more resilient, and Canada can play a role in global health. Today's big news: Canada will become a center of excellence for mRNA and next-generation medication. I have the pleasure of saying that this new technology opens doors, I think, incredibly, to find solutions for various diseases. For example, we're even looking already vaccines for cancer and possibly other disease. So for Quebecers who are here with today, we're talking about a center of excellence that will be here with us today. And we will become a global pole for research and development in this area. We're talking about a center of excellence in fabrication and research in this sector is a major advance for Canada, and we are very happy to greet you here today. Without a doubt, Canada is now a destination of choice for biomanufacturing, and I would say to my co-citizens, for the health and safety of Canadians today, it's an excellent piece of news for technology and innovation here in Canada, and it's excellent news for workers in Canada.
We are adding a key player of COVID-19 vaccination to the Canadian biomanufacturing team, if I may say. I am pleased to announce, on behalf of the Government of Canada, that we have recently finalized an agreement with Moderna to build a state-of-the-art mRNA facility, a vaccine manufacturing facility with pandemic response capabilities right here in Canada. This manufacturing capacity will leverage our country's existing scientific strengths, and I had the privilege of mentioning to the CEO of Moderna, which flew in from Massachusetts, from Boston, to be with us today, about the ecosystem we've built, the talent attract investment, and making sure that he sees all the talent we have here in Canada. And the investment we're talking that Moderna is going to be making in Canada will position Canada as a center of excellence for mRNA technology and next-generation medicines. Because as I was saying in French before, we know that you're looking at a number of vaccines to cure diseases, even cancer. So we're looking forward to your research in Canada. So not only will have a manufacturing facility, a center of excellence, but this will also position Canada as a global mRNA research and development hub. And I want to say thank you on behalf of all Canadians for believing in us, for believing in our young researcher and our ecosystem. With mRNA manufacturing facility in our own backyard, we will be much better equipped for the next global health crisis to protect the health and safety of Canadians. It's no secret that every country in the world wants a COVID-19 vaccine made in their country. And I'm proud to say, and I think you're going to reinforce that, but Canada is the first country outside of the United States where you have decided to put a manufacturing facility, a center of excellence, and a research and development center. And I must say that's something which warms the heart of every Canadian, that you think that we will be able to live up to this belief you've put in us and the trust you've put in Canadians so that we can participate together in global health. Some of the key players are now choosing Canada, as Canadians would have seen, because they know that we are committed to support science, innovation, and resilience. En terminant, je dois vous dire qu'avec des partenaires de calibre mondial comme
with partners of worldwide caliber like Moderna, I'm convinced that Canada will be a center of excellence, of choice, for mRNA and other next-generation drugs. Canada will be more resilient, with better tools to face the future, and certainly with the supply side. In closing, I would tell Canadians, let's seize this chance for major advance for biomanufacturing in Canada in our partnership with Moderna, and let's make Canada a worldwide leader in healthcare. Thank you, ladies and gentlemen. And it's with great pleasure that I have the honor to introduce the CEO of Moderna. It's the floor is yours. Thank you, Mr. Minister. Ladies and gentlemen, hello. I'm very happy to be here today to announce this a collaboration with Moderna in partnership with the Canadian government here in Canada, innovation, the promise of the technological advancement of mRNA. As a resident of Boston, but Canadian citizen, you can imagine how exciting it is for me to open a plant in Canada. More than a year ago, we had to respond to what was already a devastating pandemic. The Canadian government, I already knew, trusted our science, our clinical data, and our technological know-how. Thank you for your trust. When there were more than 200 vaccines in the fight against the virus, I appreciate the courage of the government.
Has demonstrated how our mRNA technology offers speed, scalability, and most important, efficacy, making us uniquely positioned to respond to the pandemic. I'm very pleased to announce that last week we shared new clinical data showing long-term efficacy of a vaccine. The data that was presented at the end of last year was showing 94% efficacy of a vaccine against disease, but that was at 2 months after the second dose. Last week we shared data 6 months after the second dose, holding very nicely at 93% efficacy, making Moderna the longest duration protection vaccine in the world. I am proud and humble, Monsieur le Ministre, that Moderna's vaccine has been able to help protect millions of Canadians and dozens of millions of people around the world so far. As the end of June, we had shipped 300 million doses around the world, and our output is increasing every week, every month, so we can help protect more people. Our goal this year is to supply between 800 million and 1 billion doses to the world, and next year between 2 to 3 billion doses, so that together we stop this awful virus and we go back to having normal lives. Our expansion on the ground here in Canada is even more recent. And very early in that process, we ensured to have a local team led by Patricia, established in Canada. That team has been working hand in hand every day with government, healthcare professionals, and other key stakeholders to help fight this virus. Today's announcement built on that by bringing Moderna's state-of-the-art mRNA manufacturing and science to Canada. In collaboration with Canada, Moderna wants to do 3 things. Number one, invest to have a state-of-the-art manufacturing facility here in Canada to produce vaccines for Canada and for the world. Two, to provide a secure and reliable source of innovation for the future, because COVID-19 vaccine is just our first vaccine. We're working on a high-efficacy flu vaccine that is already in clinical studies. We have a wonderful RSV vaccine. RSV is the number 2 cause of hospitalization for respiratory viruses. There is no vaccine on the market against RSV, and thousands of people die every year that we could protect. And as Monsieur le Ministre said, at Moderna we are working on cancer with 4 different drugs in clinical studies, including a personalized cancer vaccine that we make for every human being, customized for your cancer, based on the DNA of your cancer cell. We are working on autoimmune disease. We are working on cardiology, where we inject mRNA in people's heart, one intervention after a heart attack, to grow new blood vessels in your heart, so that if your heart has been damaged by the lack of oxygen, we can restore the heart function so that you can have a much higher quality of life if you survive a heart attack. And we're also working on rare genetic disease. Disease for kids have no hope today and their parents, that we're working to help so that those kids can have a normal life and the parents can have their kids with a normal life. And third in our priorities with this project is to do something that is very dear to my heart. I've worked for infectious disease for 25 years, my entire career. And I believe that this technology can allow Canada to be ready for the next virus. Whether it's a small outbreak or a big pandemic like the one we just saw, God forbid, Canada will be ready. We will be ready on Canadian soil to make, in a matter of months, a new vaccine for a new emerging virus to protect the Canadian population. And for this, I really applaud the vision and the courage of the government in Canada. As a company, we are committed to global public health. We are still responding to this pandemic, but we also want to ensure we and society at large learn from it. The framework that we established today to work with the government of Canada to be able to be ready for the next pandemic is what I believe is going to be a model for the rest of the world. To us, the revolution is just the beginning. This new technology has already changed millions of lives. I believe over the next 10, 20 years, this technology is going to change dozens and dozens and dozens of millions of lives. Permettez-moi, Monsieur le Ministre, avant de céder la parole à Madame Patricia Gauthier,
Minister and others, to thank you and your teams for your trust, for the work done. And also, this might be the foundation for several decades of collaboration. Thank you. Thank you very much.
Merci, Madame, de vous assurer qu'on respecte tous les protocoles.
Thank you, Madam, to make sure we respect all the protocols.
Bonjour, messieurs, mesdames.
Hello,
Merci
ladies
beaucoup,
and
Stéphane.
gentlemen.
Bienvenue chez
Thank
nous.
you, Stéphane.
Le fait que vous
Welcome.
puissiez vous joindre à nous aujourd'hui est clairement
Well,
un
the fact that you could
exemple
join us
concret de la
is
contribution
clear,
que les vaccins ont
concrete
apporté en ramenant une certaine normalité.
proof that vaccines have brought a certain amount of normalcy during this pandemic, but the pandemic is far from done. We hope to see you more often while we build the Moderna plant in Canada.
I also want to thank Minister Champagne. Merci beaucoup. Minister Annan, Minister Haidu, Prime Minister Trudeau, and all the other public servants for their support and tireless commitment to solutions you've shown during the long months of the pandemic. This was a true team effort that many Canadians have worked on together to fight this pandemic. Thank you so much. L'annonce d'aujourd'hui est une
Today's
démonstration
announcement
claire
is
de
a clear
l'engagement du Canada en
demonstration
santé publique.
of Canada's commitment in public health.
Ce nouveau projet
This new
offrira
project
l'accès à des vaccins
will
innovants
offer
pour
access
protéger
to
la
innovative
population du
vaccines
Canada
to protect
contre la
the Canadian
COVID-19,
public against COVID-19, the
le
flu,
et
RSV,
d'autres maladies respiratoires
and
ou
other
infectieuses.
respiratory disease.
Ce projet va aussi offrir la
This
capacité
project will
de
also
répondre à
offer
des
the
pandémies
ability
futures, ici
to
même
respond to
au
future
Canada.
pandemics here in
We're
Canada.
extremely proud of what we've accomplished together with your team and all those who've been involved in this project. This is a true partnership. A true partnership. Merci beaucoup de votre collaboration.
For your collaboration. Thank you.
Thank you very much. And this is just the beginning for Moderna in Canada. Thank you.
Merci. Merci, Madame Gauthier. On va se rappeler de vos mots ce matin.
will remember
On les a
your
bien
words this
enregistrés.
morning.
Ce n'est qu'un début. Ce n'est
You've
qu'un
said
début.
this is just a beginning. Just a beginning.
Bonjour tout le monde. Nous allons
Hello,
maintenant
everyone.
procéder à la
We will now
période des questions des
proceed to the
médias. On va
Q&A
commencer avec
with
le
the
monde
media.
dans la salle. Si vous
We'll
pouvez,
start in the
vous avancer au
room.
microphone
Please
que nous
move
avons
forward
là
to the mic.
et annoncer
Announce
votre
yourself,
nom et votre outlet
your
aussi.
name, your
Ensuite, on va
outlet,
aller une question, un follow-up.
one question and one follow-up.
Monsieur Bancel, venez, venez.
Hello.
Oui, allez-y, excusez-moi, je ne voulais
Yes,
pas
go
vous
ahead.
interrompre.
I'm sorry, I didn't mean to interrupt you. Radio Canada? Can we have more detail on the agenda, on the calendar, on the schedule for the creation of this Center of Excellence? I can give you certain details, and if Moderna wants to say more, of course they may. But clearly, in the discussions and agreement we've struck with Moderna, we're talking about the end of construction by 2024. So construction should begin soon. We're talking about an investment of several hundreds of millions of dollars on the part of Moderna, and I've told Canadians many times there's a delay between investment and construction. These are major investments, several hundreds of millions of dollars, and the agreement struck with Moderna specifies that Moderna is being established here in Canada. So, of course, there are details to review with Moderna. For example, the right ecosystem to receive the fabrication, the manufacturing. It's in 3 steps. There's the manufacturing, there's the Center of Excellence that will be created, and also the R&D Center for Moderna vaccines. So, for the moment, the agreement sees that with Canada, and Mr. Dow says in the coming weeks and months, we will have established the best location for Moderna with the support of the Government of Canada for the best location or ecosystem for them. But I must remind everyone, one of the commitments struck with Moderna and Mr. Marcel, thank you, it's not just to have an excellence center, an R&D center, but also the fill and finish being done here in Canada, so we're maximizing operations in Canada. And with all this, Moderna has committed to the Canadian government to one of the aspects of today's agreement is the resilience for supply. You know, as me, a vaccine contains a lot of things. It's being sent to several countries. What I see with Moderna is to see maximum purchase in Canada for greater resilience, which will favor public health in Canada, and Mr. Marcel said so. We're also targeting global health. So more Canada, the more resilient Canada is, the better the global health will be. So the selection of sites will be done in the weeks and come. So the drug substance and the filling to encourage resilience of Canadians with 260 new collaborators hired in Canada. What kind of research will you be doing here then? Well, we'll start with the virus vaccines, but in Canada, we want to accelerate access to products in Canada for the virus, to protect Canada from other respiratory viruses. And the megalovirus, CMV is the #1 cause of fetal malformations. So the vaccines against CMV, we have developed A phase 3 coming soon. Phase 2 showed a great number of antibodies.